This is Doug Brunk reporting from the annual meeting of the American Academy of Cosmetic Surgery in Las Vegas. Dr. Susan Obagi offered advice on ways to enhance your injectable practice.
Now, you would think, because injectables have been around for so long, that there are no new things that you could potentially learn to enhance your patient flow. And what I find is that when you actually sit down and take a look at the things systematically, you can come up with key ways to enhance your practice. So number one, I would say for sure, is to make the experience for the patient as pleasant as possible. So that starts with the appearance of your waiting room, the appearance of your staff, bringing them back into the examination room. The examination room should have a slightly more warm feeling to it. It shouldn't look like a very sterile environment. We oftentimes will have music available, we'll have brochures and magazines available for patients to read and to peruse while they're waiting for you. Now, to make it more comfortable, we make sure that our assistant is available immediately to seat the patient, put any topical anesthetic on that we need, especially if we're doing fillers. For our toxin injections, we do not use topical anesthetic, but we make sure that everything's available, everything is set up at the bedside so that you're not struggling to look for instruments and needles and syringes. Everything should be available right there, and you should just be able to quickly walk in the room, not look like you're fumbling, because for patients, this is a slightly intimidating procedure. So it goes a long way to comfort the patient to see that you look like you're very organized and that you're doing everything in a very neat and precise manner. Now, when you do the treatment, the keys that you can do to enhance the patient coming back to you is, again, to make sure that you're using the absolute smallest size needle you need for each of the injectables that you're doing. So you need to make sure that you're using fresh needles, that you change often if you're using them for multiple puncture sites, or that you're using the smallest gauge insulin needles for your toxin injections. And make sure that you have an assistant ready to hold pressure over the different areas as you treat so that you're reducing bruising. That way the patients are more comfortable during the treatment, they don't go home with a prolonged amount of bruising, and that makes them much more willing to come back. Now, we make them arrange their schedule to come back at 3 to 4 month intervals, and we make sure that the doctor is doing the treatments at that point, because you will constantly have this 3 or 4 month interaction with your patients, which are valuable interactions because they will use that time at that point to ask you questions about the next possible procedure or your next recommendation. That's golden. That's what you actually do want for your patients when they come in, so that they can have that constant interaction with you.